Today, Tyler Shandro is imposing massive pay cuts and systemic upheaval on Alberta's doctors, even as those same doctors are risking their lives to protect us during a global pandemic. Any rational person would realize that today, during an escalating public health emergency which has already claimed the lives of 9 Albertans, today is the time to put budget targets and personal grievances aside and let these professionals do their job, which is to save lives.
Their intent was never to negotiate in good faith. Their intent was never to listen and to work with the Alberta Medical Association and the sections and physicians in providing better, more efficient health care and putting patients first. For them, it was about something else. Was it about money? I don't think so. And I don't think so because I know that the Alberta Medical Association continued tirelessly to work with this government to try to bring to them an alternative. Put these consultation proposals on hold. We're going into a COVID pandemic. Now is not the time. The AMA proposal would have saved more money than what these consultation proposals are going to do.
The cuts of the government directly undermine the efforts of your frontline healthcare workers to flatten the COVID curve. In doing so, the government is willfully putting every Albertan at risk. During this time of crisis, physicians are rising to the task. Despite the UCP's efforts, we will not abandon our beloved patients. We will be there for you. However, this time of crisis will pass. And when the COVID pandemic has passed, rural care will shatter. Overworked and demoralized, physicians already are looking east and west, where other provinces have offered financial supports and stood in solidarity with physicians during this pandemic.
We're not actually in any way negotiating with the government. They're not talking to us or taking our input, but B, there's no trust. This government just tore everything up, walked away, and basically told us that our input's not important. And then C, all those things you just highlighted and talked about, those are exactly what we're saying. It's not about exact dollar figures. And in fact, all of us have said we'll sit down, AMA will sit down and find savings in the system in ways that we know can be done that won't affect patient care and won't impact Albertans. We will do that if they'll work with us. But the bigger problem is they won't work with us and they're making changes. They have no clue what's going to happen. And we're telling them it's going to be worse for Albertans, and they won't listen to us. We are all stepping up above and beyond to take care of this pandemic, and so we want to put this aside. We don't even want to fight with the government or work on the long-term things down the road. We want to get through the pandemic, and then we want the government to listen to the experts on how we save. I'm just saying, let's get through COVID. All of us are saying this, and then let's work together to save. So I hope that is strong enough for you to hear that we're asking the government to put this on hold, and then we will work together to find savings.